بسم الله الرحمن الرحيم. السلام عليكم. اليوم ندي محاضرتنا نكمل محاضرة الأنستيزيا. في البداية قسمنا الأنستيزيا إلى قسمين: Local Anesthesia and General Anesthesia. كملنا محاضراتنا عن Local Anesthesia. اليوم محاضرتنا عن General Anesthesia. General anesthesia is described as a reversible state of unconsciousness with inability to respond to a standardized surgical stimuli. هذا هو تعريف General anesthesia. In modern anesthetic practice, this involves the trade of unconsciousness, analgesia, and muscle relaxant. هذه هي ما نحصل عنها من خلال local anesthesia. Patient become not conscious and there are no any pain during the surgery and relaxation of skeletal muscle. In general anesthesia have been performed since 1846, when Morton demonstrated a first anesthesia using ether in Boston, United States of America. The general anesthesia have three important things. A variety of drugs are given to the patient that have different effect with overall aim of ensuring unconsciousness, amnesia, and analgesia. These are three important factors that have occurred to the patient to doing any major operation. Anesthesiologist, what mean this term? The doctors who specialize in anesthesia, as well as certified registered nurse anesthesia, are typically in charge of ensuring that an optimal combination of this agent are given to patient during surgery. حقيقة التخدير يحتاج إلى اختصاص في هذه المادة يدرس بعد التخرج من كلية الطب، وكذلك يحتاج إلى مساعد مخدر وهو ممرض التخدير لإكمال عملية التخدير في صالة العمليات. Overview for general anesthesia. General anesthesia is a complex procedure involving pre-anesthetic assessment. هاي حقيقة تجرى في ردهة المريض أو في صالة التحضير للعملية. Second, administration of general anesthetic drug. Third, cardiorespiratory monitoring and analgesia, airway management, fluid management, and post-operative pain relief after finishing the operation. The procedure that typically requires the administration of general anesthesia include this procedure. First, cause of blood loss, taking a long time, affect breathing, induce anxiety, and lastly, are too painful procedure technique during surgery. The general anesthesia in general have four planes. The first one call it monitors, second one call it drugs and fluid, and the last one airway management. This lead to have induction, maintenance, and emergencies and post-operative care. The objective of anesthesia: first, unconsciousness. The patient become not conscious, amnesia, and not forget anything during surgery. Analgesia, there are no pain during surgery. The oxygenation, that have enough breathing, that taken on oxygen. Ventilation, that have good airway. Hemostasis, there are no any bleeding during surgery. Airway management, reflex management, muscle relaxation, and monitoring to all vital signs. The rules of anesthesia. First, the preoperative evaluation and patient preparation. You must evaluate any general condition of the patient and prepare it for taking general anesthesia. Intraoperative management, that include general anesthesia drug that have inhalation anesthesia and total intravenous anesthesia. There are regional anesthesia and pain management. There have many local anesthetic anesthesia like spinal, epidural, caudal, and block, and peripheral nerve block, pain management, acute and chronic pain. Post-anesthetic care that have after finishing the operation, how manage the patient. Anesthesia complication and management. You must know any complication that occur to in general anesthesia and how treat it. The preoperative anesthetic evaluation that have you must prepare the patient before anesthesia. You must take an chest X-ray to see if there are any problem in chest infection or asthmatic or any problem that general anesthesia due to is related to inhalation. And the HP of the patient must not anemic, and you must do renal function, general urine examination to have a kidney, both kidney not any problem, for anxiety excretion of the general anesthetic drug. The risk of anesthesia, if there are any emergency for the giving an anesthesia, you must know it and how you deal with this risk. The physical status have classified to this for 6 categories. First class, a normal heating patient. Patient deal with patient with normal condition and they give him anesthesia without any problem. Class 2, a patient with mild systemic disease, no functional limitation, no have any problem from this systemic disease and can give him as class 1. Class 3, a patient with severe systemic disease, some functional limitation. There are some limitation and give pre-medication. You must give him like hypertension or diabetic patient. You must give some pre-medication to control the blood pressure and the glucose and then do operation. Class 4, a patient with severe systemic disease that is constant threat to life and functionally incapacitated that have need more precaution for giving anesthesia and like that bleeding disorder that have you must control the bleeding problem and then give him an general anesthesia. Class 5 are morbid patient who is not expected to survive without the operation. If this is an emergency condition that have you must and give him certain precaution to give a general anesthesia. Class 6, a brain dead patient whose organs are being removed for donor purpose. If there are any problem in the brain that lead to a dead patient, that it is very important to be ignored this operation. And added other categories with the classification of physical status here, emergent procedure, where have an emergency that can give to the patient. Pre-anesthetic evaluation. Before giving a general anesthesia, we can do some technique for this. The first is history. The medical history, current medication, previous anesthesia. حقيقة يجب أن نأخذ من الكيس شيت اللي كنا نسويها أيضا نكون ناخذ البريكوشن للجنرال anesthesia ناخذ الميديكال history in general and if the patient can take and certain medication for a long period, and if there are any general operation under general anesthesia. And then do clinical examination like the age, weight, teeth condition, that it is very important, airway assessment, neck flexibility, and head extension. حقيقة كلش مهمة نفحص نعرف عمر المريض and the body weight إنه في حالات الأندر weight that is very dangerous and are overweight, it is not have good give take airway for the patient. Teeth condition, the teeth have not have any carious teeth that have during induction of the tube that lead to fracture of the crown. Airway is very important to see there are the nose and the mouth and the larynx, and the trachea have no any abnormality or any infection that lead to problem during anesthesia. The flexibility of the neck and head extension is very important to know any fracture in the cervical vertebrae when given put a tube during the given general anesthesia. The investigation that have need relevant to age and medical condition. حقيقة احنا ثلاث شغلات مهمة for young and adult patient هو ال HP general exam and chest X-ray. البيشنت above 45 يجب أن يعمل ECG to see the cardiac healthy. The plan of general anesthesia, the first best combination and drug and dosage and degree of how much monitoring is required. حقيقة يكون نحسب drugs that have given to general anesthesia and the dose according to age and healthy of the patient. The patient must be fasting time, how long the fasting before giving general anesthesia. If airway management is deemed difficult, then alternative placement methods such as fiber-optic intubation may be used. حقيقة في حالة إنه إذا نسوي له intubation by ordinary way by endoscopy that have other type of this procedure by fiber-optic intubation. The NPO. What mean NPO status? That means nil per oral cavity have taken. That meaning nothing by mouth. So if doing anesthesia, you must not taking any food or fluid during operation. This the first one, solid food 8 hours before induction of general anesthesia. Second, liquid 4 hours before induction. Clear water 2 hours before induction. And for pediatrics, stop breast milk feeding for 4 hours before induction. حقيقة قبل ما تبدي العملية هي الأفضل أنه ما يأكل خلال ال8 ساعات الأخيرة ولا يشرب أي سائل خلال 4 ساعات ولا يشرب ماء خلال آخر ساعتين before operation. We need a pre-medication. This done at هذه البريميديكيشن أفردها أو بصالة التحضير. The aim of pre-medication induce drowsiness and induce relaxation. The time of it from a couple of hours to couple of minutes before the onset of surgery. حقيقة من ساعتين إلى دقيقتين نقدر نعطي في حالة الإمرجنسي condition نقدر قبل دقيقتين نعطي pre-medication. The drugs that use narcotics like opioids such as fentanyl and sedative most commonly benzodiazepine such as mirtazapine. And then give a general anesthesia. This general anesthesia, you must control the monitors, pre-oxygenation, induction including RSA, respiratory system induction and recoiled pressure, muscle relaxant, mask ventilation, intubation, and ETT position comfort, maintenance, and emergencies. The airway examination. We have classified the airway to the 4 categories. Class 1, it is a more simple technique. I can see uvula, frontal pillar, and soft palate visible. In class 2, it is slightly difficulties that can see frontal pillar, soft pillar, and visible. In class 3 is can see soft and hard palate visible. Class 4 only the hard palate visible. هذه حقيقة when open mouth very widely إذا قدرت تشوف هذه كلها طريق airway during mouth is very easy. But if there are only hard palate, it is difficult to do narrowing of the airway. Snuffing position. You put the head of the patient more this posteriorly and it supported and the neck nape of the neck supported and that have slightly to see the larynx, the Adam apple, and can easily to induct the tube. The mask and airway towel. This is the type of mask and airway towel that can push the tank anteriorly and can give the first ventilation during this before that intubation of the mask ventilation and intubation. You must laryngoscope use before put the and you can see the larynx and the vocal cord to enter the tube, oral and nasal airway. We can do it either by oral technique by put the through the mouth to the nasopharynx to the larynx and can do it through the nose through nostril and enter it to nasopharynx, oropharynx and enter to the larynx. Intubation by put laryngoscopy and can use the epiglottis to see the epiglottis and then enter the tube through the epiglottis to the trachea. The intubation after insertion of the laryngoscopy we call endotracheal tube enter to the mouth or to the nose. This view through laryngoscopy can see the vocal cord and the opening to the trachea and can enter it easily. The laryngeal view scoring system that can see if there are slight opening or moderate or no opening through the view. Fast track LMA, it is that in emergency case we can put this tube and can do the induction. This is the LMA system that have used during intubation. The induction agent, how can give induction easily? By opioid, by this drug you have like fentanyl and propofol, thiopentol and etomidol and muscle relaxant like diplorazine and non-diplorizing agent. The induction, we have two type of drug, either inhalation or intravenous. The inhalation where IV access is difficult, antiseptic, difficult intubation, and patient preference like children. The intravenous is faster onset and avoiding the excitatory phase of anesthesia. Intravenous induction agent. Commonly used intravenous induction agents include propofol, sodium thiopental, and ketamine. They modulate the GIP-ergic neuronal and transmission is the most common inhibitor neurotransmitter in human. The duration of action of intravenous induction agent is generally 5 to 10 minutes, after which time spontaneous recovery of consciousness will occur. هاي حقيقة بعض الدراج used for induction راح أذكرها على السريع. The propranolol is short-acting agent used for induction, maintenance of general anesthesia and sedation in adult patient and pediatric patient older than 3 years of age. It is highly protein bound in vivo as metabolized by the congestion liver. Side effect is pain or injection, hypotension, and transient hyponia following induction. صوديوم ثيوبنتال هو أكثر شيء يستعمل. Rapid onset, the ultra short acting barbiturate rapidly reach the brain and cause unconsciousness within 30 to 45 seconds. The short duration of action is due to its redistribution away from central circulation toward muscle and fat. The dose of induction is 3 to 7 mg per kg. Causes hypotension and apnea and airway obstruction. Ketamine. Ketamine is a generalized dissociative anesthetic that it is classified as an NMDA receptor antagonist. The effect of ketamine on the respiratory and circulatory system is different when used at anesthetic dose. It will usually stimulate rather than defer the circulatory system. The inhalation type of induction that most commonly used agent is sevoflurane because it causes less irritation than other inhaled gases. rapidly eliminated and allow rapid awakening. The stages of anesthesia. In 1937, Arthur Ernest Caldwell classified to four stages of anesthesia. The first stage, induction. Patient can't talk in this stage, but they begin to slow lose consciousness. Stage 2, excitement stage. The patient completely lost consciousness and may experience an irregular heart rate. There may also be uncontrolled movement. Third stage is the surgical anesthesia. هذه هو في الستيج اللي يجب أن يعمل به العملية. The skeletal muscle begin to relax and eye movement stop. The patient is unconscious and ready for surgery at this point. The dangerous stage, stage 4, is overdose. At this stage, too much medication has been administered and the patient experiences severe brain stem or medullary depression, which can be fatal without support. During operation, intraoperative management. First, monitoring to vital sign. Second, position, supine, lateral, on sitting, lato, and fluid management, and like give him a crystalloid, a vasculoid, and nil by mouth fluid replacement. One first 10 kg weight, 4 mg per kg per hour. Second, 10 gram weight, 2 mil per kg per hour, and 1 mil kg per hour thereafter. Intraoperative fluid replacement, minor procedure 1 to 3 mg per kg per hour, and major procedure 4 to 6 mg kg per hour. Major abdominal surgery 7 to 10 kg per mil hour. The emergencies that occur during the operation: turn off agent, inhalation or IV agent, reverse the muscle relaxant, return to spontaneous ventilation with adequate ventilation and oxygen, section upper airway, wait for patient to wake up and follow command, and hemodynamically stable. The maintenance phase. In order to prolong anesthesia for the required duration, usually the duration of surgery, patient has to breathe carefully controlled mixture of oxygen, nitrous oxide, and a volatile anesthetic agent. This is transferred to the patient's brain via the lung and the bloodstream, and the patient remains unconscious for the time of period that needed for surgery. Inhaled agents are supplemented by intravenous anesthesia such as opioid, usually fentanyl or morphine. At the end of surgery, the volatile anesthetic is discontinued. Recovery of consciousness occurs when the concentration of anesthesia in the brain drops below a certain level, usually within 1 to 30 minutes, depending upon the duration of surgery. Total intravenous anesthesia. This is involved using a computer-controlled syringe drive pump to infuse propofol throughout the duration of surgery, removing the need for the volatile anesthetic. Advantage of this technique: faster recovery from anesthesia, reduced incidence of postoperative nausea and vomiting, and absence of trigger for malignant hyperthermia. Neuromuscular blocking drug. You give block neuromuscular transmission at the neuromuscular junction. Used as adjacent to anesthesia to induce paralysis. Mechanical ventilation should be available to maintain adequate respiration. Type of neuromuscular technique. The first, non-depolarized. Second, depolarization. The non-depolarization is competitive and an antagonist against acetylcholine at the site of postsynaptic acetylcholine receptor, like atricum, venericum, and rocaricum. The depolarizing action, that depolarizing the plasma membrane of skeletal muscle fibers similar to acetylcholine, like 6-methanium, onset 30 seconds, the duration 5 minutes. Airway management. To maintain an open airway and enable mechanical ventilation, an endotracheal tube or laryngeal mask airway are often used. Either use endotracheal tube or laryngeal mask. During monitoring, you must have ECG, pulse oximetry, blood pressure monitoring, agent concentration measurement, low oxygen alarm, carbon dioxide measurement as carbonography, temperature measurement, circuit discount alarm. This is the machine that used in general anesthesia in the surgical theater. Post-operative management. After finishing the operation, the post-anesthesia care unit, that oxygen supplement, pain control, nausea and vomiting, hypertension, hypotension, and agitation, and surgical intensive care unit, mechanical ventilation and hemodynamic monitoring. في غرفة الإفاقة يجب أن توفر فيها هذه الأمور لكي يكون السيف anesthesia. The post-operative analgesia, minor surgical procedure or moderate surgical procedure or major surgical procedure، تعتمد على النوع العملية. فإذا كانت minor surgical procedure, oral pain relief medication can give paracetamol and non-steroidal anti-inflammatory drug like ibuprofen. In moderate surgical procedure, addition of mild opiates such as codeine. In major surgical operation, combination of modalities, patient-controlled angiography system like involving morphine. Health condition or factor that increase the risk of complication on general anesthesia, like the smoking, obesity, diabetes, high blood pressure, drug allergies, alcohol abuse, heart condition, and sleep apnea that lead to more complication in general. The complication and management of general anesthesia. The first, respiratory complication, like aspiration, airway obstruction, pneumonia, bronchospasm, atelectasia, hypoventilation. The second, complication for cardiovascular complication, hypertension and hypotension, arrhythmia, myocardial ischemia and infarction, cardiac arrest. General anesthesia complication, that neurological complication that lead to slow wake up and stroke. And the most important major complication, it is malignant hyperthermia. The mortality rate for patients have taken general anesthesia, overall about 5 deaths per million. The most commonly related surgical factor or pre-existing medical condition like hemorrhage and sepsis. Common cause of death directly related to anesthesia including aspiration of stomach content, suffocation due to inadequate airway management, allergic reaction to anesthesia, human error, and equipment failure. There are specific consideration for extraction under anesthesia. حقيقة احنا في دول اوروبا وشرق اسيا يعملون قلع تحت التخدير العام، فهذه يكون ناخذ categories when do this operation. You must take careful history, take care of airway support of mandible and position of patient head. The dental surgeon should never act as both operator and anesthetist. حقيقة يجب عن طبيب الأسنان أن يشتغل مخدر مثل التخدير الموضعي، ولكن أكو أخصائي تخدير وهو يشتغل as a surgeon. Preparation for anesthesia. That first, accompanying person no driving 6 hours of null by mouth, emptying the bladder, lost the tight clothing, patient comfortable in dental chair, head slightly extended, mandible should be parallel to the floor of the theater room, arm and leg position of patient, waterproof apron, hearing of patient's each breath. Pre-operative consideration before doing any operation for extraction. Identify the tooth that need to extract. All procedures are removed. All instruments should be kept ready. Larger anesthesia, increasing risk of anorexia and aspiration. Ideal time for working their extraction 5 to 10 minutes. Special arrangement, dental probe, mouth gag, mouth pack, efficient suction apparatus, tracheostomy kit. هذه يجب أن تحضر before doing any extraction under general anesthesia. Modification of extraction technique. You must do it. Tooth priorities. Avoid excess force to the mandible. Soft tissue injury should be avoided. Postpone removal pulp if it is exposed. Fracture root was resolved root. You must be in careful condition. Thank you for your listening this